Thank you. Developing of a new device for static and dynamic test of nickel titanium instrument for root canal treatment. It's a cooperation between the University of Engineering and the University of Catania, so Faculty of Engineering at the University of Catania, and the Faculty of Medicine, in particular the dental clinic. Okay. The endodontic surgery is linked to any kind of pathologies linked to the inside problem of the tooth. And one of the most important practice that the endodontic doctor have to front is the devitalization of the teeth. And this is some image about the canal root is sometimes very long, sometimes very with a lot of curves, like in position, and for this practice, the teeth have to be drilled with a particular kind of files. These kind of instruments are called generally files, and we are studying about the resistance of it. The use of rotary instrument of nickel titanium alloy represented in the endodontics the greatest innovation to the instrumentation. Particularly, the advantage can be summed in 3 points: speeding up the operating procedure, streamline procedure, effectiveness of treatment. The fracture of the instrument in nickel titanium during rotation occurs for 2 different kinds of mechanisms: torsion fracture and cyclic bending alternating fracture. It is necessary to establish the performances in the use of a rotary nickel titanium alloy instrument in critical practice expressed as safety of fracture risk. The behavior of this tool has to be investigated both in static field as well as on the resistance and variable number of cycles. Aim of the paper: we are carrying out a research, program research, in order to unify the performances of different instruments for the root canal treatment. The program involves both static and dynamic response, either in terms of torsion or in terms of fatigue bending. The present paper will present a torque meter that we have designed and built to for the first part of the research. Then the static response in terms of torsion. In order to verify the device efficiency, 3 series of different types of root canal instruments were tested. The torque meter was designed and realized based on the standard international standard organization standard for this kind of required real-time measurement of torque exerted by a low-speed motor. Connection between 2 chucks, one to the handle of the root canal instrument and the other fixed on the tip. And the principle was very simple. Was the simple based on the principle of the precision balance between torque produced on the analytic instrument by the stepper motor, and the resisting torque measured by a strain gauge load cell. The strain gauge provides the value of force F2, and obviously for the same, having the same arm, the balance equal and opposite to F1, and then it's possible, easily possible to measure the torque. There are the two representations, the design representation of the instrument and the realization. For the realization, we have used a stepper motor with programmable electronic board from fidget stepper bipolar motor, an incremental rotary encoder, and the program used was Java for fidget board and NetBeans for the compiler. We can see here the stepper motor, the encoder outside, the two-lever arm, the balance is this, the load cell, and the pulley linked to the two chucks that are that constrain the base and the end of the instrument. One problem was linked to the final moment in which the instrument will fail. Because we need with a high precision the load and the time in which the instrument is here failure. And for this we have to create a circuit linked to the motor energy that stop the energy when the instrument is broken. But because of the electric arc, it's necessary also to provide a spring here to assure that when the instrument is broken, the circuit is open. The load cell was calibrated before we create a particular kind of cell because the load is very low, and it was created by a strain gauge tracked between two silicon stripes, and the strain gauge of the national instrument, and this is the calibration of the system in loading and unloading to assure that there is a good linearity. The experimental analyses were made on three kinds of instruments. There are an iFlex, MT2, and a protaper next. And we can see the torque and the angle rotation for the three types of instruments. Particularly interesting is the moment in which the failure happened, and then the motor stop is energy. After this, the dynamic test was performed. The dynamic test only for a little number of cycles. Then means 20 or 40 cycles at the 25, 50 or 75 of the maximum torque, respectively, because there is no perfect linear behavior between the torque and the angular rotation. The tests were performed under control of angular rotation and before correspondence between the angular rotation and the torsion was carried out to assure the correct load. With this board, it's possible to see clearly the hysteresis of the instrument, and the hysteresis were estimated by the cyclic measure processed by MATLAB a different number of cycles, and after a few cycles the hysteresis area stabilized its shape. In conclusion, in order to perform a testing campaign on a nickel titanium instrument in different loading and environmental conditions, based on the standard, a dedicated meter was designed and realized. Preliminary campaign of tests was performed on two different types of nickel titanium instruments, either in static loading or in low cycle torque loading. On the basis of the data collected, it was possible to define the inside behavior of the different nickel titanium instruments, following a response with a large number of couples torque rotation for each cycle. Thank you for your attention.